And we have now just enshrined, as soon as I sign this bill, the core principle that everybody should have some basic security when it comes to their health care.
That President Obama 3 years ago this Saturday, signing the health care reform bill into law. Now, if you support health care reform, that moment, watershed, decades in the making. If you opposed it, then you were cheering last week when Republicans in the House, as part of their budget vote, voted to repeal Obamacare for, if you're counting, the 36th time since it became law. So what has Obamacare done to this point, and why are there still so many questions about it for so many voters? Andrew, you've been looking into those questions.
Well, it's hard to know exactly what the impact is because a lot of the law doesn't take effect until 2014. But the New York Times did an analysis, and they said so far Obamacare has expanded health care coverage, particularly to those who were uninsured before, kids under the age of 26 and people who have gotten free preventative care. It has saved money. It's actually reduced the cost of health care in some examples and has improved by some measures the quality of care. Now that public opinion of the law, however, is a little bit different and remains sharply divided. The Kaiser Foundation recently asked people about individual aspects of the law that voters either liked or did like. And what did they like? We have something to show you here from the Kaiser Foundation. A majority of the people who were polled liked all of these individual elements with the majority support that are all part of Obamacare. So what don't voters like? Here's the list. The individual mandate, the only aspect of Obamacare, Rich, that gets majority disapproval 3 years down the road. You have to wonder if this is a sales question. Has the Obama administration not really sold health care reform yet? Is it the slow rollout? It seems the more people know about it, the more they like it.
Dominic, I think we could all answer their sales job has never been really good on this one. But do you think opinions will change by the time Obama leaves office? The idea is that a lot of the impact stuff hasn't really been felt yet. And that people will get it more, or do you think people will say, you know, I know a lot of people in a lot of different walks of life, not just Republicans in the traditional sense, I know people in the hospital industry are conflicted on this thing. When Obama leaves office, what do you think people look at this issue as?
First of all, bad sales job by the administration. I do believe the premise of your question that it will change as more of these matters kick in. A quick personal situation. Of people that were not covered before. Quick example, if you're a college kid in the past, at 22 when you're on your parents' insurance, like my daughter was with us, you're kicked off under the old system. You're on your own. In this day and age, most kids are getting jobs part-time and they don't get health insurance. So my daughter didn't have health insurance. Friday, she delivered a baby. I became a grandfather.
Congratulations.
And thank you. I don't want to be a grandfather yet, but it was covered by the insurance. She would not have had coverage if not for Obamacare because it continued because she's not 25 yet. So that's just one example out of a long list.
I know you don't like it.
Well, maybe there's some parts of it that are good, but President Obama made a huge mistake, the way he crammed this through Congress. Every major piece of social legislation, whether it was a New Deal or whether it was a Great Society, was passed with bipartisan support. This is the first big piece of social legislation that's passed with bipartisan opposition. Every Republican voted against it and 34 Democrats voted against it. And that's because it's basically a bad piece of legislation. So the Republican opposition will continue.
You agree.
Some
you can equally
Democrats
argue it takes two to tango. That at different times in this country, different parties move closer to the middle to try and find common ground.
It's just a basic strategic mistake that Obama made. It's going to continue to decline in popularity as health care premiums go up. The problems with the medical system, medical care system, will be blamed on Obamacare, and eventually it will get, if not repealed, very
I think we can agree on this. Time will tell. And we will take a quick break here. But we have a question as we go out to break. What do you think when it comes to Obamacare? Good or bad for this country? Head over to our Facebook page and share your opinion on Twitter as well. Our debate will continue online. All right, when we come back, we got some political stories. Stay with us.